thank you to the 6-0 organizing committee for inviting me. I have one important disclosure, and that is that Marc Muren and I did not discuss our respective cases before we came this morning, and you'll see why I'm making that comment. So this is a 35-year-old gentleman with keratoconus, and I start marking. I'm using a Hanna tree fine to do a 300 micron depth trephination, then deepening it in one small area with a diamond knife. I'm inserting the Sarnicola, first of all the spatula and then the cannula. Watch where the tip of the cannula is here. I'm injecting air, and all the air is going into the anterior chamber. So the first question to you is, if the first attempt at big bubble creation fails, and you have air in the anterior chamber, what do you do next? Answer number 1, or A, abort, DALC, and convert to PK. B, abort surgery altogether and return on another day. C, attempt to create a visco bubble at the same location. And D, attempt to create a big bubble at another location. You can all submit your answers. Yeah, so that's what I decided to do. I decided to attempt to create a big bubble at another location. So here we go. I find another location. I push the probe or the spatula in first, and then I put the cannula. This is the Sarnicola cannula, and I'm going to inject. All of the air goes into the anterior chamber. So I'm getting a little discouraged. The head nurse in the operating room is saying to me, you know, you have a lot more cases today. Let's go, let's go, let's go. Let's convert to PK. So here are the options. If a second attempt at big bubble creation fails, end the surgery and just call it a day. Go home. Second option, abort DALC and convert to PK. Third option, proceed with layer-by-layer dissection of the stroma. And D, keep trying to achieve a big bubble through repeat air injections. Go ahead and submit your answers. So we have kind of a split decision, but the majority answered proceed with layer-by-layer dissection of the stroma. And I'll show you what I did. So I start out by debulking the anterior 300 microns, which was my initial trephination. And then what I'm going to do here, actually with a cannula, I'm going to inject balanced saline solution into the posterior lamella to kind of thicken it. And then I'm going to continue layer by layer dissection until I achieve what I hope to be a sub 80 micron residual stroma. You can see reasonable clarity of the cornea there. And then proceeding with removal of Descemet's membrane off the donor and grafting it into position. Only reason I used fluorescein at the end because, as you know, there was a little perforation, although it was kind of close to the center of the cornea, so I doubt there would be leaks. Of course, you have to worry about a double anterior chamber and manage it usually the next day. So in conclusion, when unable to create a big bubble, consider layer-by-layer dissection of the corneal stroma to complete your DALC procedure instead of converting to penetrating keratoplasty. Thank you.